Texas is blessed with great geographic and cultural diversity. So as we developed our plan for health information exchange in Texas, we knew that we'd have to support different models at the local level.
We have a network of local health information exchange organizations across the state that is largely focused on our urban areas. Then we have a lighter layer of connectivity that we offer to providers in the rural areas of the state.
This is important because what makes sense or what would be supported by physicians and hospitals in the Dallas and Fort Worth Metroplex is likely different than what would be supported in Houston. And what offers value to providers in Houston is likely different than Central Texas, the Rio Grande Valley along the Texas-Mexico border, and the Northwest Texas Panhandle.
This is all connected together by a layer of technical services that we are in the process of developing at the state level through the Texas Health Services Authority.
I believe there's strong support for HIE in Texas because of the approach we're taking, which is locally controlled, market-based, allows hospitals to develop solutions that work within their regions and amongst the providers that they work with.
We're in the world's largest medical center, the Texas Medical Center. It's a very busy level 1 trauma center, which means that we get some of the sickest trauma patients imaginable here, from major car accidents to gunshots and stabbing victims. One of our challenges is having access to accurate information on patients, and a lot of times our patients can't provide information because they're too sick, or because of their injury they're not conscious. That information could be vitally important. We don't want to miss anything that the patient doesn't remember. We don't want to give them the wrong drug because we don't know their allergies. We don't want to repeat a CAT scan that we don't have to if they've already had one, because that's more radiation for the patients.
It's important for the emergency medicine doctors and nurses that are in the emergency room, when we bring people to them, to know what we've done, to know what information we found out, to know our EKGs, for instance, because they can either continue the treatment plan that we've started or not repeat something that maybe has already been done by us.